We think the Obamacare expansion of Medicaid is reckless. We're pushing people, 20 million people, into a program that's failing. More and more doctors and hospitals don't even take the program. So we want to reform Medicaid by giving states the ability to customize the Medicaid program to meet the unique needs of their Medicaid populations.
But
these are good
can you really say
that we think will make the programs better.
But can you honestly say that by turning Medicaid into a block grant and giving it to the states, that you can cut $770 billion out of that program over the next 10 years, and it's going to have no impact on legitimate recipients?
These are increases that have not come yet. So by repealing Obamacare and the Medicaid expansions, which haven't occurred yet, we are basically preventing an explosion of a program that is already failing. So we're saying don't grow this program through Obamacare because it doesn't work. Prevent that growth from going because it's not going to work. It's going to hurt people who are trying to help. It's going to hurt hospitals and states, and give the states the tools that they're asking for. Indiana is a perfect example. They have a fantastic Medicaid program that Mitch Daniels created in Indiana that is popular, that's successful, that's working well, but Obamacare prevents it from going forward. We want to give states like Indiana, states like Wisconsin, the tools they need to make these benefits work for their populations, and we don't want to push more people into a failing program. And by not pushing people into this failing program, we do save these kinds of dollars.
I want to pick up on this because I must say I didn't understand this. Are you saying that as part of your budget you would repeal, you assume the repeal of Obamacare?
Yes.
Well, that's not going to happen.
Well, we believe it should. That's the point. This is what budgeting is all about, Chris. It's about making tough choices to fix our country's problems. We believe that Obamacare is a program that will not work. We believe Obamacare will actually lead to hospitals and doctors and healthcare providers turning people away. It's a program that basically puts Medicare under the control of 15 people on a board that will determine what kind of benefits people get. That's a rationing board, however you slice it. We don't think healthcare is going to be improved in this country. We think it's going to look very ugly over the next couple of years. And that's why we're going to propose replacing Obamacare with patient-centered healthcare, with a better healthcare system for everybody, for the poor, for people in the states, for Medicare, so that we can actually have affordable health insurance for everybody, including people with pre-existing conditions, without costly government takeovers, which is what Obamacare represents. And yes, our budget does promote repealing Obamacare and replacing it with a better